Welcome everyone to the 9th episode of Per Ardua Ad Astra, where we welcome Dr. Riya Kulshrestha, who got a rank of 261 in INI November 23. Thank you so much, Riya, to be here.
Thank you so much for giving me this honor.
It's our honor, Riya. So let's start with the part 1, that is academia. As the name suggests, it's about the academic things of your college life. So our first question is, why did you choose surgery, as we got to know?
I would like to answer this in detail a little later, but I chose surgery right from second year itself. But there were certain factors which played role in changing my choice of branch when I came to final year, and then again during these last 9 months I came back to choosing surgery, which was my initial choice.
What is your opinion on coaching? From which year you should take it? Also, is marrow enough? That is a common question of every medical student.
The coaching should start based on what your exam pattern is going to be, and from last 4 or 5 years the NMC has been very crazy about the exam pattern. They have been changing it like within few days.
Yeah.
So if it is going to be NEET PG and INICET separate, then third year is a very safe zone to start from. However, if it is going to be next, which is before your internship starts, I will suggest second year. So overall, if you are starting from second year, it is a good and safe zone to start with, but in second year your main focus should be textbooks and prof rather than the coaching part. You should focus on making the notes and using pharma and micro notes especially because they are the ones in which we have a lot of mnemonics, and you cannot go on changing mnemonics like you made in second year one pharma notes and then in final year or internship you change them, because sometimes even to remember mnemonics you need mnemonics. So keep the pharma and micro notes with you from second year itself. Other subjects will be fine if you do from third or final year also.
Okay. So our next question
is marrow enough?
Yes.
Marrow is more than enough. A lot of my batchmates, juniors, seniors have said it's actually way too much than asked. So even these days, I will say go for online coaching platforms. I used Marrow, only QBank, and my main source was from Dance Notes. However, when I was during my preparation, I said I solved the previous year questions, and I looked at how the app interface. App interface is a very important thing these days because we are supposed to give the exam on a computer. So it is very important that our app is also simulating that exam, which was very well simulated in Marrow, especially when I was giving the test on laptop. So, and their explanation is also very nice. So even the question bank, that is plan B, is more than enough to crack the exam in so say 6 or 7 months duration. However, my main source was DAM, so I could not change it after internship. That would, because I had always read those notes. I could not go on from, I had a visual memory of many of the pages. So what I did was I used to solve QBank and only annotated the previous year questions in my notes, because now everyone has understood the game very popular. One has made it very popular that previous year question bank has to be solved. So I used to annotate them and mark them, like for INI I used to mark them with red color and for NEET I used to mark them with pink. Okay, it's it. And if it was something to be added, which was a lot because DAM source were quite concise and precise, which they boast about, but still they were very lacking. So I used to add a lot of things. So then I used, for few subjects I used marrow notes, like in anatomy. I will suggest go for printed notes, because you get a lot of image-based questions. So you will already get those printed notes for anatomy. Similarly, microbiology and pathology, you will get the slides printed.
Yes.
And from the beginning itself, when you are reading the notes, you will have the habit of looking at the picture besides your notes.
Yes.
And gradually, when you will keep on revising a lot of things, I used to add beside the picture only. So I did not used to see the text, I used to just see the image, and that's it. Like in this said also, they gave a cut section of the chest. So usually they ask CT scan on chest, but this time they gave a anatomy specimen. So if your anatomy is good, your surgery and radio, they are going to be good. So image based studying is very important for these three subjects. And coaching, you should start, I think, from second year, if it is going to be next pattern. And but focus on reading the textbooks and use the notes to assimilate what is given. Sometimes textbooks are way too overwhelming. Yes. To read. I mean, you cannot even complete one paragraph and you are asleep. So that helps. You read the notes, you know what you have to pick from the textbook, highlight it, because sometimes people will just highlight the entire page. So that is also there. So you know. So that is also there. So you know what is important, what I have to see in the note, in the textbook, and then that will help you to memorize it better. And also before Viva, notes come very handy to revise rather than the textbook.
Is it true that the image-based questions are from particular set of standard books?
Yes, yes. Okay. So they are from particular set of standard books.
So we should refer them for the images.
Yes, yes. Like in surgery, there is so many radiological investigation-based images that they ask, and there is a section in Valiant Love entirely about radiological studies. I never even saw that section. But during like my preparation, I just opened one day. I was feeling like Bailey ki shakal dobara dekhte hain क्या? So I just opened it and it was like, oh my god, these are the same images I solve every day in questions, and I never even saw them. Like there's one on manometry that we do for echolithia cardia and various pressure changes that are there in esophagus. So these all images are there and they are asked from mainly from Valiant Love. And plus the coaching institutes will definitely compile those notes for you in their printed notes. But if it's an added advantage if you're already doing it from the textbook, because you will be reading it for your prof also.
Okay. So moving forward, what was your routine while preparing and when did the initial preparation started?
So my preparation started initially in third year when we joined NAMS. However, COVID came, everything was in the lockdown. So for 1 month, like there was nothing. We used to just sleep. There used to be nothing. And initially we had completed like 3-4 subjects. So my senior had said whatever notes you have made in third year, keep on revising them at least thrice before your final year ends. So I made it a point that by the time my third year was over, I had revised those notes twice and solved the DAMS question bank. However, I personally felt it was not a good source of question bank to solve, because the explanations were not something which I was satisfied with as compared to marrow. We will come on the how MCQ solving skill. There I will describe how I changed the skills of solving MCQs from DAMS after DAMS.
So we are already moving to the next question, the tips to approach the MCQ. Please elaborate me.
So solve MCQ. If you are in second year, do not focus much on solving MCQs. Focus on revising the notes, and maybe because pharma is a very volatile subject, you can like practice active recall by solving MCQs. But even if you don't, it's fine. By the end of final year, it's important that your notes are there with you. Even that is the basal minimum thing that you are supposed to do. By the end of final year, your notes should be ready. Even if maybe you have not read it due to any circumstance, anything can happen. But this should be done. So I used to solve initially MCQ like roaming here and there, traveling in metro. I was a day scholar, so it was not very active record. If I know if it's a factual question, I know. If it's not, I used to just say, okay, this is the right answer. But that was the wrong approach. Then I changed it to you are solving a question, you know the right answer, but why are other three wrong? That's the best approach, because then you are solving four questions in one question and covering four different topics. So this was one thing. Then in TNT, during internship, I could not give a lot of TNTs, but in the grand test, I gave grand test in TNTs this year. So my approach used to be, in grand test I used to do from marrow. So it has an option of I am guessing this answer. So always give your test on laptop, because it has a simulation of the real exam, and give yourself an environment of which simulates the real exam. Like I'll tell you, in May exam what happened, it was scorching heat, the center was somewhere, I don't know, in a remote area, and there was no AC, so they switched on the cooler in my hair, and they don't allow you to wear your own rubber band. You will have to wear their given very thin rubber band, cheap material. So my hair was all on my face, and it's so irritating. You cannot wear clips in eyeliner, you cannot wear your own rubber band. So what I did after May was, I simulated that. I used to switch on the cooler, I used to just put that kind of rubber band, I had one. And so that annoyance, I got used to that annoyance. And GTs also help you to get over the anxiety of giving a 3-hour test. Like TNT is 1-hour test, but GT is 3 hour with strategy. So initially it used to be just sit and give the test for 3 hours, and the skill used to be the same. Why am I marking this answer? Why are the other three wrong? And even if there used to be one option which I was guessing, I did not know anything about anything new, I used to just mark that this is I am guessing. So initially in GTs, it used to be 167 guessed questions, and after that, review those tests on that day itself. Um, I don't suggest reviewing the entire 200 questions. What my approach used to be, skipped questions first, then see the wrong questions, note them down very, like, in 2 lines. Like this was asked, and no need to. Marrow gives a very elaborate explanation. So just note why my option was correct, and what were anything new that was there. And then I used to see the guessed correct. Just scroll through them, just to see whether the way I had marked that question was right or not. If my approach was not being followed in that question, then I used to see what's the actual approach they have used. Especially for numericals, it used to be like that. And so in this way, initially I used to give like one GT for INICET every month, and later on in September I stopped actually. Because my score came to be skipped questions first, then see the wrong questions, note them down very, like, in 2 lines. Like this was asked, and no need to. Marrow gives a very elaborate explanation. So just note why my option was correct, and what were anything new that was there. And then I used to see the guessed correct. Just scroll through them, just to see whether the way I had marked that question was right or not. If my approach was not being followed in that question, then I used to see what's the actual approach they have used. Especially for numericals, it used to be like that. And so in this way, initially I used to give like one GT for INICET every month, and later on in September I stopped actually. Because my score came to a plateau. So I then, my main focus was actually to go for NEET PG, and I was not a goal, but however this time they changed the pattern. They changed the pattern to 4 time slots of 45 minutes each, with 50 questions in each time slot. And my biggest weakness in INICET GTs was time management. However, I gave they uploaded a GT with 4 time slots on dams. So I gave that a day before just to get used to it, and I decided I was doing preparation for NEET second reading, but I had solved AIMS PYQ and NEET PYQ in my first reading itself. So I was well acquainted with the pattern that they asked. The main aim was to just go and sit there and attempt, because every attempt is an opportunity. And this time, however, although the pattern changed, but the level of questions decreased. It was almost like NEET. I would say there was no numerical at all. The INICET is famous for asking numericals. NEET will never ask. And they give the admit card also to allow you to do calculations on it. But this time there was no calculation. Otherwise, match the following, multiple correct answers were there. But I think they are coming in NEET also. Very few, but they are there in NEET pattern now. Because now I think they are going to merge the pattern and give it in in a single exam that is next maybe. This was that, but the level of questions decreased, and hence my score was really almost like I used to score in GT, and the percentile also. I mean, the rank was similar to what I was getting in GT. Also, yes, never focus on the rank in GT. Never focus on the score. Focus on the number of correct questions that you are doing, the number of wrong and skipped. In tests, you can have a very aggressive approach, like attempt 190 plus always. Okay, you will have less skipped questions, you will have more wrong questions, and that red wrong question that stabs your heart like anything. So you will see that question with full emotion, that why was it wrong, and slowly work on decreasing the number of wrong and increasing the number of right, and keep your attempted question 190 plus. So this is for test, and similar approach was there for solving the Q. From third year onwards, it's important to solve questions, and whatever subject you are covering, try to cover the question bank on that day itself, but do not add everything in your notes. It's not, everything is not important. They give extra questions or extra topic to make you comfortable with the idea that this will also be there in the real exam. There will be questions which you don't know, there will be questions which you have never even heard about or read about, but then it will be there for everyone. The question bank which will have all the topics which are there in your notes, you will score best, but everyone will score best. And there will be, like pharma had, in the last part of the pharma Q bank, there are this monoclonal antibodies and new drugs. I used to score so many wrong questions, but still my this percentage of attempted question used to be very nice, because other people also did not do that. So get into the habit of solving questions, in a given time limit, because now INICET pattern has changed, and maybe for the next two INICETs it will be like that until next comes. So attempt questions, like if there are 50 questions in 45 minutes, so you can calculate one question has to be solved in how many minutes, and make custom Q bank for you, which allows you to do questions in a given time limit. Because sometimes it used to happen that you do get distracted with lot of things around you, family, friends, things which go on in personal life. So when you are attempting questions, there will be hundreds of things going on in your mind, and you will not even see that on one question you are stuck for 5 minutes, but you can't do that in exam. So at least attempt 1 or 2 custom questions bank every day, so that you get into the habit of solving question in a given time limit, especially small sets, because that is what INICET is going to do from now on. And for NEET PG, there is 3.5 hours. So if I actually got into the habit of doing very fast, because I gave GTs for INICET only, 6 or 7 for this first 6 or 7 months this year, and then I stopped and then started with NEET PG GTs, because the date was announced. So, but it has 3.5 hours. So I used to be left with 1 hour, because for INICET my speed increased very. I had increased my speed a lot. So NEET will allow you to be relaxed in that. So target INICET, but practice both patterns.
Okay. the very commonly asked questions. How to revise first and second year subjects in third year and final year?
See, actually, you don't even need to revise first and second year subjects in third and final year, because if you're someone who has read them in first and second year thoroughly itself, you will not need anything to do extra, because anatomy is the basis for radiology, for surgery, for ophthalmology and ENT. Like head and neck is the basis for all the neurosciences, neuroanatomy. So if you are thorough with anatomy, you will be able to do surgery, and that will be repeated actually in surgery. And now the questions are getting more and more clinical. So the coaching institutes do cover the clinical aspects and the basic sciences along with that subjects. Like Rohan Khandelwal sir will always tell you the anatomical basis, and then slowly take you to the pathology part, then to the clinical aspect, and then treatment. So treatment is something which is asked in the end. The first three should be clear, and the first two will be clear within first and second year subjects. So if you're someone who has read Robbins, like in internship I was not able to prepare well for this thing, code, I mean NEET PG, but whenever somebody used to ask me anything which was based on first and second year subject, I had a good memory. I had, and trust yourself, you will recall it. ठीक है, वो लगता है कि नहीं याद आएगा, but आता है. I used to be able to answer them because I had read them thoroughly. I had like for anatomy I had attended BH, so there was visual memory. Like I can still recall holding that hard specimen and telling all its boundaries. So when I read, it's there in my memory, and always read and just go and teach someone. That's the best. Then biochem is something which is very volatile. So what you can do is get notes of biochem, even printed, or you can make on your own and revise them. And for prof, of course, you will need textbook. Similarly, physiology, either you read Guyton or you read Genome. Do not go for other source. Genome is short, you can cover. Even Guyton is very good if you have started well. I read Guyton. Again, the same reason, standard textbook will give you standard terminologies, and they will allow you to recall those terminologies in the exam also. Because वहीं से pick करके वो notes बनवाते हैं, and the images are also the same which they ask in exam. So you will be able to recall. The concept is very, very clearly explained. There is no controversies on that also, because they are the standard textbooks. Again, then in second year pharma used to be my biggest fear. I think it's for everyone. Even this INICET also, everyone was discussing about the pharma questions. So as I had suggested, make pharma notes in second year from whatever source you want to. All are good. The idea is to have those notes and keep revising them till the end. Do not change them. Same for micro, but micro again get printed notes so that you can have images with you, because they are very fond of asking image-based questions in micro. Pathology, first and foremost, is Robbins. After that, if you get time, you can go for notes. Even printed notes will work, but printed notes will also have the same images as Robbins. So first go for Robbins, make your concept clear, because it's said that medicine is the queen of all subjects, but even the pathologists also say that it's not. The pathology is the main subject which you should be clear about, because that will be the basis for entire medicine. Medicine in the sense, any subject you can take, because without it you cannot be thorough with any of the branch that you want to take, even radiology.
So that's it with the first part.
So from second year onwards, I had developed this. In the first year also, I love to do dissection, and anatomy was one of my strongest subjects. However, except very few topics here and there, but if there were, overall it was one of my favorite subjects. So in second year, I had developed this interest in surgery. But then COVID came, so our clinical postings were not there at all. I mean, surgery you can't do you can't see and discuss online. Although there were case discussions, I used to attend them and make notes, but otherwise I was not getting exposure to as such what actually is surgery all about. And in third year, I found I actually got very anxious slowly and slowly. I mean, whatever you can say, COVID took a toll, or studies took a toll, or actually I had been brought up in a very restrictive environment. So all this became very overwhelming. College life, interacting with people. So like initially it used to be very difficult for me to sit in a batch of 200 because I could not even used to say a complete sentence with people of about 4 and 5 around me. So I was like, I can't do a clinical branch. I mean, I will not be able to do a core clinical branch. I will go for a branch after third year. My opinion changed that I will go for a branch where there is almost nil patient interaction, or maybe person interaction, almost nil. I wanted to do that, and my friends were also like, "Yeah, you are antisocial. You are like, you can't do that." But so I decided it because it was very popular among the clinical but not very patient interacting radiology. Okay, radiology, pathology. Among the preclinical, I loved pathology, and then. It was Dharma. Dharma initially in PG you have to do interaction, but then later on you can do online this consultation as well. वैसे तो मेडिसिन में भी आ गया है, but still Dharma में you can safely do and earn well. So, but then I was like, I could not develop somehow this interest in radiology much. Even if it was there, okay, it's just for me investigation part. And during internship, this idea of not interacting with people just like became 10 times stronger, because it was very frustrating in internship. You do all this cut work and then it's like नहीं बात करने किसी से मुझे just give me a branch and I'll take a branch जिसमें मुझे work life balance is a different thing. I'll just describe that. आई जस्ट डोंट वांट अ ब्रांच जिसमें मुझे पेशेंट इंटरेक्शन या पर्सन इंटरेक्शन करना है. मुझे ऐसी चाहिए रेडियो पैथोडर्मा, ये 3 मैंने बना ली थी. बट उसके बाद व्हेन इन बट इन द बैक ऑफ माई माइंड इट वाज लाइक ये नहीं चाहिए ये तो नहीं करना. एंड ऑफ कोर्स मेंटल हेल्थ बिकेम वन ऑफ the most important criteria for me, at least, because in COVID I saw we all saw losing so many bright minds of the country among the medical fraternity itself. Even still we hear a news. Last week we also heard a news. So mental health did became a big criteria, and I felt like maybe if I will force myself into a clinical branch, it will further exaggerate, because surgery as a field is said to be very toxic, very hectic and this. But slowly as the internship came to an end, and during this 9 months of preparation, I came to realize that yes, it is hectic because it has a lot of responsibility to deal with life. Similar is with medicine also. It's just that you're not doing the just less physical work. However, now I have come to realize after seeing all these kinds of news that toxicity is not in the branch, it's in the people who are there in that branch. So if you can be a cycle breaker, right? If you are in a branch, say anesthesia also, I heard such kinds of breakdowns or attempts in this in anesthesia also, in a non-clinical branch also. So it's not in the branch, it's in the people that are there in the branch. In like I came across very what you can say nice people in surgery department. The people whom I worked under, even here, even in I have interacted during these last 2 months in AIMS Delhi, in PGI Chandigarh. I went to IMS Bhubaneswar also. I was allotted in the first round. Even there, the people are very nice. There is no such thing as toxicity. There will be strictness, but those are two very different things. Because strictness is important. You need to be responsible for what you are doing because you are dealing with lives. That's why people feel it to be hectic. And definitely government is not playing a great role in decreasing the hectic part of medicals, being in medicine or in surgery or in any other branch. So mental health did became a very important criteria, and I was like, I will not be able to like handle any clinical branch. I was like, medicine bhi nahi chahiye, even though I was good, but nahi chahiye. So in third year also I was into treatment, and that really helped me. So gradually I gained confidence. Even in internship, for half of the internship I used to never interact with anyone. I used to do the work which was allotted, just do it and go back to my room. After 6 months only I just started gaining confidence, and then this voice came, no, you can't do radiology, you are not interested in radiology, you are not interested in dermatology. So during these 9 months, I just removed them from my choices, and after that, then I decided I'll go with whatever I had decided in second year only. I was interested in surgery. In fact, I have never given my Bailey and love to anybody. I gave all my final year books to textbooks to everyone. I mean my juniors, but it's still there with me, Bailey and love. So. I decided that I will go for the choice which was there. Yes, it will be hectic. Yes, it will be very, maybe toxic, but because now I have worked on my mental muscle, I'm like, okay, there will be toxic people. There were toxic people, the seniors in internship also, but then there, in that same unit there were good people also. So you hold on to the good ones, you appreciate the good ones, you try to be like them, and let go of the toxic ones. They will be like that. They usually know what they give excuses like our seniors were also like that. Mostly you will hear that कि हमारे साथ भी हुआ था, या हम भी पिले थे तुम भी पिलोगे. ये this is what they do. But you can be a cycle breaker. You can build on that mental muscle of yours, and try to change yourself. No need to change others. And it's mostly the toxicity. A person that any person who shows toxicity is actually their problem. It's nothing to do with you. So that's why I came to surgery finally. I was like, this was my initial choice and I will go with it. It will be hectic, but then other branches are also equally hectic. Academics, you need to have a schedule, but it should not be so like jam packed that you are not able to have time for yourself, because it's college. You go through teenage, you go through family, personal life, college life. So have a schedule, like show up for yourself at least for 1 hour in studies, and at least definitely for 1 hour in any other activity which allows you to be just you. Because everyone is able to study. People will study like anything, they will score like anything in GTs, but the main game is mind game. The person who is able to maintain his calm a month before the exam, a week before the exam, a day before the exam, they are the one who score. Everyone in the range of, like, I would say 200, 300 are someone who are very capable of being at the first position. But why? What happens is what you have done in those 3 hours, how you have maintained your calm in those 3 hours, and to do that is not by just studying, but also by allowing yourself to trust in yourself by showing up for in other activities. Because after like your MBBS, you should not have regretted I devoted entire time to studies. It will create a lot of frustration. You will have to work upon your what you can say, mental muscle, because not just your academics will play a role a month before the exam. How you are keeping, like, I think every medical procrastinates. I used to do. Okay, like I used to sit for 1 hour, procrastinate like 45 minutes, and then cry. What happened? Now I just have 15 minutes left. So I worked a lot in internship. That's why I was not able to. I used to procrastinate that this is the time that I have, and this is how much I have to cover, and I will not be able to do it. So I gave up like twice or thrice. It was one of my junior, one of my friend who kept on motivating me कि नहीं दी आप मुझे पढ़ा दो चलो. Then I started teaching her or reading with her, and that's how somehow I just completed first reading, and then I gave up. I will just read DVD and go and sit in the exam. Khatam. Then also I was able to grab a rank of 8,000, which is decent enough, at least for surgery. But I wanted somewhere where you don't have a bond. So I did not pick up a branch over there in NEET PG. So do work on your mental muscle apart from academics, because Lady Harding will not let you sit without studying. That is for sure. And the competition is so much that you will not be in a place where you are not reading anything. You will have a lot of sources. There are a lot of sources. Choose one. For your main notes, I will suggest after COVID and from COVID onwards, I think online sources are good. I will not personally suggest to go for offline coaching, because online classes you sit every day with your own will. So nobody is forcing you, or there is no obligation that, oh, I have 9-hour class today and this has to be done, because it may not be recorded or it will be live, so I have to sit. But in online coaching where you already have classes, you you are there. Initially you will lag behind, definitely. Your peers who will be in offline coaching, they will be covering a lot of subjects very fast. But what happened with us, at least in my group friend circle, was that we completed so many subjects in third year, but then there came a gap of 3 months where our profs got postponed, and everything, and there was news about next on our batch, and I went crazy what to do, because I never had the habit of sitting by myself to study. The entire year DAMS used to schedule classes, and then we used to sit. So online coaching, you get into the habit of sitting by yourself, because in internship you will have to make your own schedule. Although there will be a D&D schedule, there will be this and that, but according to your postings, according to your comfort, and you will have to make your own schedule and sit by yourself. So I think you get into the habit of doing that by online coaching. Wherever you do, in library or in your room, wherever you feel comfortable. But I think that is an advantage which comes with online coaching. Plus, the app interface are much better, I feel. I had used only Marrow among the online sources, but I have taken reviews before like this interview from other sources as well, and they are very good enough. Especially they have this rapid revision which has come up. I use that. I use Marrow also for that, and it's very good. For DAMS, I would say TND, DAMS and Bhatia, TND, and their DVT. DVT, or you can go for BTR. It has also become popular. However, for your main notes, keep one source. Anything specific that you want to ask?
Like, why did you choose surgery? And second, did you know that, from first year itself, that you want to choose surgery?
We will discuss this. No, आपको अभी next part में discuss करना है क्या?
I think ये खत्म ही हो गया ना.
हाँ, now we have the second part.
इसी में started surgery, तो फिर non-academic.
हाँ, इसी में
मेरे पापा बोलते हैं कि मुझे भी सर्जरी ऐसे इंटरेस्ट है.
हाँ, सेम मेरे पेरेंट्स ने भी बोला करना क्या एक और.
हाँ दी, ये तो दी चल भी रहा है. आप इसको बताइए. हाँ, अभी इसके बाद है इस पे questions, but ये पूछ
ये कि वर्क लाइफ.
हाँ, मेरा भी कहता है वर्क लाइफ बैलेंस की वजह से मैंने सर्जरी भी थोड़ा नीचे कर दिया था. बिकॉज माई पेरेंट्स वर लाइक कि ऐसी ब्रांच चुन लो जिसमें घर भी देख सको. वो फॉर एवर टिप रहती है फीमेल्स को कि घर चलाना है तुम्हें, बच्चे तुम संभालोगे. बट इसमें मेरी सीनियर ने बहुत हेल्प की थी, शुभी दी ने, कि यू चूज़ अ ब्रांच फर्स्ट. ठीक है, अपना पहले पर्सनैलिटी देखो, रेस्ट घर बच्चे एंड जो भी पार्टनर है वो दे विल फॉल इन टू दिस थिंग्स. अपने आप को चेंज करोगे तो तुम्हें रिग्रेट और फ्रस्ट्रेशन रहेगा. फिर तुम ना उस अपने काम से खुश रहोगे, और फिर बिकॉज वहाँ तुम अपना सेटिस्फाइड फील नहीं कर रहे, तुम घर पे भी सेटिस्फाइड फील नहीं करोगे. तो इट वॉज वन थिंग. एंड वर्क लाइफ बैलेंस से ज़्यादा इंपॉर्टेंट होता है वर्क लाइफ प्रेजेंस. फिर मैंने ये भी देखा है कि अ पर्सन विल हैव द एंटायर डे टू स्पेंड अपने फैमिली के साथ, बट वो इतने डिसोसिएटेड या डिस्ट्रैक्टेड होते हैं ना फ़ोन में, सोशल मीडिया पे, या दिस इज़ द टेंडेंसी ऑफ टुडेज जनरेशन. वो अपना प्रेजेंस नहीं देते. दे आर देयर टू स्पेंड बट दे आर नॉट एक्चुअली स्पेंडिंग टाइम. तो आई थिंक कि सर्जरी में मैंने तो एटलीस्ट जो देखा, लाइक व्हेन यू डू सर्जरी यू आर 100% इन दैट मोमेंट. सो वो एक मेडिटेशन की तरह हो जाता है कि यू आर लाइक प्रैक्टिसिंग, बिकॉज आप नहीं ध्यान हटा सकते. तो योर ब्रेन गेट्स यू यूज टू फोकसिंग इन द मोमेंट. सो वो मुझे लगता है कि वो बाहर भी अप्लाई हो जाता है जब आप अपने फ्रेंड्स के साथ या फैमिली के साथ होते हो, तो आप ज़्यादा अपने आप को ऑथेंटिक वे में प्रेजेंट कर पाते हो. वरना तो बहुत लोग ऐसे होते हैं कि होगा पूरे 2 दिन होंगे, या एटलीस्ट जैसे मेरे एक अंकल हैं, उनके पास टाइम बहुत होता था. लाइक वो मतलब नॉन मेडिको हैं, सॉफ्टवेयर इंडस्ट्री में. ही हैड अ लॉट ऑफ टाइम टू स्पेंड विद फ्रेंड्स एंड फैमिली, बट स्टिल आप देखोगे उनके पास इतनी मेमोरीज नहीं है बच्चों के साथ, बिकॉज वो उन्हें स्पेंड कैसे करना ये नहीं पता. तो अ सीनियर ऑफ माइन ऑल्सो टोल्ड कि एनेस्थीसिया में तुम्हारे पास इतना टाइम होगा कि स्पेंड कैसे करें ये ही नहीं समझ में आएगा. तो इतना खाली भी नहीं बैठना कि पागल हो जाएंगे, करें क्या, कितना घूमोगे, कितना फ़ोन चलाओगे. मतलब इफ़ अगर आप सोशल मीडिया इन्फ्लुएंसर हो तो अलग बात है, या इंस्टाग्रामर हो. मैं तो नहीं थी ना, मुझे आदत है सोशल मीडिया या इतना सोशलाइज करने की. आई हैव ऑलवेज बीन इंट्रोवर्ट. तो मेरे को मतलब ये बात भी सही है, मतलब ले लिया एनेस्थीसिया तब भी बोरिंग ना हो जाए. ठीक है नहीं बोरिंग, नॉट इट्स नॉट बोरिंग एज अ ब्रांच. वो इमरजेंसी मेडिसिन की तरह ही हो जाता है. बट वही कि अगर वर्क लाइफ बैलेंस की वजह से आप देख रहे हो तो हाँ वो है इम्पॉर्टेंट क्राइटेरिया, बट इतना भी नहीं कि आप अपनी मनचाही ब्रांच को पीछे रख दो. सर्जरी फील्ड में भी लोग वर्क लाइफ बैलेंस, अगर आपने जैनब मैम का नाम सुना हो, जैनब बोरा मैम जो BTR कराती हैं, है ना, उनके हस्बैंड न्यूरो सर्जरी में है, ठीक है, एम्स में. बट वो मेंटेन करते हैं अपना वर्क लाइफ बैलेंस. अपने जो डॉटर है उन्हें देते हैं उतना टाइम, जितना मतलब टाइम इन द सेंस टाइम विद प्रेजेंस, एंड दैट मैटर्स, क्वालिटी ऑफ टाइम. तो अगर आप 10 मिनट भी दे रहे हो बट दे आर लाइक 100% you, that will be appreciated. At least I will appreciate that more than giving like 1 hour with zero attention of yours, है ना. तो वर्क लाइफ बैलेंस से ज़्यादा इंपॉर्टेंट है वर्क लाइफ प्रेजेंस. तो जैसे मैं और मेरे फ्रेंड्स मिलेंगे आधा घंटे के लिए, बट बिल्कुल आधा घंटा अपनी प्रेजेंस मतलब देंगे एक दूसरे को. ऐसे शुभी दी इज इन सर्जरी, न्यूरो सर्जरी एम्स. अगर मैं इफ़ शी डजंट हैव टाइम शी विल नॉट अटेंड एट ऑल, बट जब वो अटेंशन देंगी आपको शी विल गिव यू लाइक 100%. like आपसे इम्पॉर्टेंट पर्सन ही नहीं है कोई इस दुनिया में, ठीक है. तो इट्स दैट इज़ इम्पॉर्टेंट. फिर वो ब्रांच के हिसाब से मतलब उसके हिसाब से अपना ब्रांच इतना चेंज मत करना अनलेस इट इज़ लाइक वेरी वेरी इंपॉर्टेंट फॉर यू. एंड हाँ वो हो सकता है क्राइटेरिया, उसमें कोई वो बड़ी बुरी बात नहीं है. बट इफ़ यू आर लाइक कि हाँ मुझे इतना टाइम मिलेगा और अपनी 100% प्रेजेंस मैं दे सकती हूँ, देन डोंट चेंज दैट. जैसे एक फ्रेंड था मेरा, उसको था कि मुझे कटिंग और ह्यूमन टिश्यू से कोई टच रखना ही नहीं है, बट मुझे मेडिसिन भी नहीं करनी, मुझे रोज़ रोज़ OPD नहीं अटेंड करनी. मुझे ऐसी ब्रांच चाहिए जिसमें मेरा क्लिनिकल हो, क्लिनिकल नॉलेज मुझे रहे, ठीक है, बट एट द सेम टाइम मुझे मतलब इतना डायरेक्टली इंटरेक्ट ना करना पड़े पेशेंट को. मैं पर्दे के पीछे काम करने में भी ठीक हूँ. मतलब एनेस्थीसिया एक्चुअली होता नहीं है ऐसा, बस ये है कि पेशेंट आपको कभी पहचानेगा नहीं अनलेस यू आर बहुत आगे जाके आप पेन क्लिनिक में वो कर लेते हो स्पेशलाइजेशन. तो
हाँ इसको पॉज करते हैं.
So now we're into the second segment of this interview, that will be the nostalgia exchange. So the first question will be, who has been your biggest influence and what lesson did the person teach you?
My biggest influence in this entire journey of medicine till now has been my senior, Dr. Shubhi. because she had helped me overcome a lot of these doubts which I had about myself, my branch, and this and other things in general. So I had learned a lot from them, from her, especially overcoming this self-criticizing internal Riya that is there inside me. She was the only one who actually I asked for help initially when I was feeling very anxious during those days, and she connected me to somebody, and I was feeling very shameful because I was like, I'm such a bright person. Why is it like मुझे क्यों anxiety हो रही है, मेरे को तो नहीं हो सकती. So they just talk to her. Psychiatry में उन्होंने मुझे हमारी सीनियर का नंबर दिया था. तो उसके बाद से I mean they so she had been the biggest influence, and apart from that, even in internship, whenever there used to be certain things like non-academic that I had trouble with interacting with, I already always had trouble interacting with people. So I used to tell her that this person said this today and I am not able to overcome it. Her motive is just live with the attitude of no F's given. Just live with that attitude. Any person being toxic is not about you, it's about them. So I think she had taught me a lot about not just academics. Academics, so I was someone who could do, but the main problem for me was socializing with people, because in medicine it's important. You are introvert, that's fine, but you have to speak, you have to explain a lot, because patients are these days they do doctor shopping.
Yeah.
And you have to gain their trust by explaining them nicely. You have to say whatever is there, but don't give them a lot of false hope, or and you have to sell yourself also that I am the person you can trust. So that you can build by having a good conversation. So this was something which I learned from her.
So my second question would be, now that the college life has been over, so what has been your favorite memory?
My favorite memory was since I was a day scholar, so we never used to get a lot of time with my friends. So it used to be sitting on the Audi steps and doing lunch with each other. Just lunch kiya and a lot of gossip, sharing each other lunch boxes, and then in internship it became chatting in the PG mess. So we used to text each other that okay, I am on duty today, let's meet for lunch or dinner at this time, and we used to just sit and bitch about all that is happening around us in internship, how we are being overworked, how somebody is being toxic, how much nice one person is to us. So this was the best memory.
So what would you change about your college life? Do you have any regrets about it? And what would you have done differently?
I think the thing which I said about doing apart, things which you have to do apart from studies, like my friend circle was always the people who were study shamed, if you know that terminology, like you call out these people who ये तो हमेशा पढ़ते रहते हैं. I regret that I did not speak up for myself, and also did not start this working on my mental health earlier. Although I did do it on time, I mean the best time could have been possible, but still I feel कि थोड़ा और जल्दी करती तो अच्छा रहता.
So you said you were an introvert. How did college life make you more extroverted? How did it help you?
Initially, like in college life definitely helped, but in first semester I used to be the kid who used to sit in a corner and just watch books, read कर रहे हैं नहीं पता. So slowly I developed friendship with one of the person in our group. She was very famous for her social skills, very well mannered and nice person, always helping others. So धीरे धीरे करके एक ग्रुप बन गया जिसमें हम 3 लोग 100 से पहले थे, 3 लोग 100 के बाद थे, और बस इन्फॉर्मेशन शेयर होती थी कि हमारे बैच में ये होता है, हमारे बैच में ये होता है. धीरे धीरे करके हम लोग ऐसे फ्रेंड्स बन गए. और फिर ये था कि हम लोग का एक तो स्टार्ट उनके साथ हुआ इंटरेक्ट करना. व्हेन आई फेल्ट सेफ विद देम टू इंटरेक्ट, धीरे धीरे करके आई फाउंड कि हाँ बाकी लोग भी मतलब it started gradually, but it took an entire first year to develop rapport with some of the batchmates, and there are 200 people, you can't even remember everybody's name. So one day I sat and like everyone was entering, and I was like, just tell me their name. Because that friend of mine, her name is Kavita, she knew everybody's name somehow. She used to tell me, iska naam ye hai, iska naam ye hai, and I'm like, I will memorize that. But COVID came and then I forgot everybody's name. I then just remembered, okay, this is the face, I don't know the name, or I just remember name, who is the face, I don't know. So that also happens with an introvert. And as I said, I learned from my seniors a lot. I learned by observing and observing how my friends are interacting, how people are interacting with others, and Shubhidi. And during internship, I saw a lot of our PGs, how they take people into their stride. Like you will hear the news of doctors being beaten up because patients don't trust them. But I not in the first 6 months, but after that, slowly I started to observe like how my PGs are explaining things to patients. I don't need to chit chat with them. I just need to be professional and need to explain that this is um, what is there. This is what needs to be done. Apart from that, I am still an introvert. Being introvert was not a problem at all. It's not a problem, it's just your personality. The problem was the social anxiety and the self-criticism that comes. That is something extreme. You have to work on that, but being introvert is fine, I guess. I think.
So we heard you had a very tight-knit group in a friends group. So in college that supported you throughout your MBBS journey. So how did you find such friends? Because most of us struggle to find such friends. And that support is at every moment.
So they are not actually real friends, they are real people, very authentic people. So as I said in during our previous interaction, initially I used to be very, very shy, but one of them, Kavita, was like, everyone knows that she is a very social and nice, well-mannered person and very hardworking. So initially my interaction started with her because in an art and I mean in practicals we used to be like, we used to have the same or near a round table. So that's how friendships start. BH tables and physio practicals. So our friendship also started like that. Then she had developed a friend circle from day one. So one of her friends, they used to travel together in metro. So metro buddies are also, metro is also a place to find one of friends. So she introduced me to the other people, and another reason we all came together was because we were also introverts and we were also felt what you can say like an outcast कि ये तो पढ़ाकू लोगों का ग्रुप है. तो मैं ऐसे करके साइड हो गए थे कि ये इंट्रोवर्ट्स हैं, ये पढ़ाकू हैं और ये कुछ नहीं करते हैं, मतलब ऐसे पढ़ाई के अलावा कुछ नहीं करते हैं. तो इसलिए हम लोग का एक ग्रुप बन गया था जिसमें हम अपने मतलब एंड ऑल्सो आर ideologies, our values, our work culture was very similar. If you like, I saw that even in internship, wherever we had work, everyone used to say कि हाँ ये this person is very like hardworking intern. This was a very hardworking person, and this was consistently heard about all 6 of us. And a lot of times we were almost there in the same units, but at different points of time. So this is what I used to hear about them, or they used to hear about me. So that's why, because we had similar ideologies, maybe similar upbringing, and then similar problems of how our batchmates used to treat us and consider us as what you can say only studying and not doing anything else. But we created a space where we used to discuss not just studies, but family, friends, relationships, songs, mimicry, everything. And I think humor was our, as a group, humor was our best coping mechanism that we could have had.
So part 3 is a rapid fire round. So you have this option and you have to choose one. Night owl or early bird?
Early bird.
Books or video?
Books.
Anatomy or pathology?
Both.
Okay. Bangla sweets or Jain chawal?
Bangla sweets.
Splash or cocktail?
Splash.
PG mess or UG mess?
Depends where you are. If I'm in the hospital, I'll do the PG mess. If I'm there on a PDOing room, then UG mess.
Chocolates or pastries?
Chocolates.
Viva or theory exam?
Theory exam.
Okay. And it's a question just came in my mind, and then we're going to wrap up it. It's a popular saying, you don't choose Harding, Harding chooses you. So what are your views on this?
That is true. Harding chooses you to make you a person and a woman who will have a very very big contribution in society, because here you will learn to be you. I mean, you will like in the morning you will just walk into the lecture wearing pajama. There is nothing else, nothing more than that you can do with the saying that be yourself. I don't know if it is possible in co-ed or people do that. I don't know, because I was in first round allotted in this Baba Saheb Ambedkar. So the kind of again, because I was introvert, so there were another level of anxiety that I was facing in co-ed. Not I was in a co-ed school also, but again वहाँ पे यहाँ पे आके आपको अपनी कैपेबिलिटीज पता चलती हैं एज अ पर्सन, नॉट जस्ट अ वुमेन, एज अ पर्सन इटसेल्फ. बिकॉज मुझे ऐसा लगता है कि इवन हार्डिंग के जो पीजीज मैंने देखे हैं, दे हैव दिस हैबिट ऑफ नेवर आस्किंग फॉर हेल्प. वो खुद करते हैं जो प्रॉब्लम सॉल्व करना होता है. दे यू डेवलप योर ओन पर्सनैलिटी. वैसे तो हर कॉलेज करता है, बट हार्डिंग विल चूज यू टू मेक यू अ पर्सन एज वेल एज अ वुमेन who is going to have a great contribution in society, not just as a medico, but also as a female, as a strong female.
So thank you so much, Say, for being the part